I'm Yuchun. I'm from Group Last Minute, so I'll talk about the Aquarium-based HCI evaluation and prototype improvement of a smart healthcare support system for remote patient monitoring. So I'm going to talk about the smart home healthcare support system, which is a ubiquitous computing system. So the system integrates the IoT sensors, a mobile app, smart home automation, and a web portal to remotely monitor the patient's health. So it collects the real-time physiological data such as pulse, blood pressure, glucose level, temperature, and weight, while also allowing the user to control the home devices like lights and fans. And it also uses the HSC model to adapt to context changes in the home environment. So the main problem addressed is the risk and inconvenience of the frequent hospital visits for the continuous monitoring. This becomes more critical during the pandemics like COVID-19, where the hospital visits increase infection risk and overload the healthcare systems. It's also challenging for the elderly and disabled patients due to the cost, stress, and also the loss of independence. The target users are the patients who need to continuous monitoring at home, especially for the elderly, disabled, or quarantined individuals, and also the healthcare professionals who remotely track patient data and provide medical decisions through the web system. The system is also important because it supports safe and independent living, reduce the healthcare workload, and improve the access to the continuous medical care. The system is suitable for UC and HCI evaluation because it applies the contact awareness, LT integration, and implicit interaction to reduce the user input. From an HCI perspective, it also emphasizes the simple, transparent, and low coordinative load interaction, which is important for the vulnerable users.
Good day to them. My name is Tam Chia Ho. I will present about the Aquarium-based HCI evaluation for the smart home healthcare support system. Starting with the content awareness, the system demonstrates a very high degree of correctness. Our primary evidence for this is its use of the hybrid analog to context, which is the HSC algorithm. It is dynamically filter out the environmental uncertainties like a sudden drop in room temperature, ensuring the wider side transmitted reflect to the true real-world situations. Next is movability. The system store medium to height here. Because the system boundaries are defined by the patient's entire home, they are not tethered to a static hospital bed. They can move seamlessly from the bedroom to the living room. The wireless communication between the wearable sensor and the Android gateway ensure there are absolutely no loss of the health tracking while the user is melded. For the transparency, we found mixed result. The system has a high degree of implicit interaction for monitoring. The wearable biomedical sensor captures the wider side with complete transparency and zero explicit input. However, the transparency drops when the users need to control the smart home appliances or report the COVID-19 symptoms. This action forces the users to interact explicitly with the mobile interface. Moving to the addition, the system does a great job minimizing the unnecessary focus changes because the background transmission of the health data allows the patient's primary activity to remain completely uninterrupted. However, the system reliance on the mobile app for login daily symptoms and controlling the room thus force the users to shift their focus into the digital interface, which increase the explicit input. Finally, we evaluate for the claimless. The system operates as a high claim system for the patients. Interaction relevancy is high. It only explicitly alert the patient when it is the time to take medications, which keep them free from the digital anxiety. However, it is slightly less claim for the doctor. If the web dashboard does not properly filter the continuous stream of data, it could potentially lead to an overwhelming influx of updates. This concludes the Aquarium evaluations.
Hello, my name is Guan Litong. For the UC architecture, we use three-layer architecture consists of application, network, and procession. So for the device and sensor, we have wearable biomedical sensors, smart home devices, and software or services. We have patient mobile app, HSC algorithm, cloud server, doctor, web dashboard, emergency alert service, smart home control service. And then the network, we have Bluetooth, Wi-Fi, cellular communication. For the user, we have patient, doctor. For the environment, we have smart home and ICT system. So this is the smart DEI. So for the D device, we have sensing device, processing device, activating device. So for the environment, we have physical environment and ICT or virtual environment. So for the interaction I, we have IHCI, EHCI, CPI, and HHI. And then this is the UC requirement. So we have context awareness, distributed system, IHCI, autonomy. So for the UC interaction, we have HCI. The patient can use mobile app to log symptom. CCI, the sensor can send data to the smartphone and then the smartphone can sync with the cloud server. And for the CPI, the system can convert sensor reading into digital data to control physical device. And for the HPI, the patient can physically interact with the environment. For the HSI, the patient can communicate with the doctor through the system.
I'm pausing and I'll talk about the improved HCI prototype and design justification for our system. The first HCI weakness in the current system is attention shift via explicit inputs. So the patients were required to manually interact with the mobile application to control smart home devices, which can increase attention shifting and reduce transparency. The next weakness is a lack of proactive calmness in symptom logging. The current system relies on the patient remembering to open the app to log symptoms, which can lead to missed data if the patient is fatigued or sleeping. The next weakness is potential cognitive overload for healthcare providers. If a doctor is monitoring multiple quarantine patients, a continuous stream of raw sensor data can overwhelm them. As you can see here in the system, it's not very intuitive for the doctor to use. The first improvement that we have implemented is voice-activated environmental control. So a patient can say something like, "I feel warm," and the system will automatically turn on the bedroom fan accordingly. The next thing is context-triggered proactive prompts. The wearable sensor detects an elevated body temperature, and the mobile app will push a notification saying your temperature is slightly elevated or experiencing chills. And the patient can choose yes or no. If the patient chooses yes, the app will guide the patient to take a rest and recover, or if they need to contact the doctor. And the third improvement is component-based doctor dashboard. So there is 3 modules: the critical alerts module, real-time vitals trends module, and prescription module. So these 3 modules will allow the doctor to process complex data efficiently without visual clutter. So here's the patients tab showing the symptom logs of the patients. And here is the real-time alert page showing the heart rate and temperature of the patients. And here's the chat tab for the doctor to talk with all the patients that he's currently managing.